Dr. Donald Clemons, board-certified dermatologist in Johnson City, Tennessee. I retired from my derm practice and I've been doing cosmetic dermatology for the last 10 years. We got our Zimmer Z-Wave about a year ago, mainly to use it for our cool sculpting patients. I started doing erectile dysfunction with it and fell in love with the results. And so we started seeing what else could we use it for, and just like talk about a couple of patients we've used it for scar repair and scar revision. The first is a young lady in her early 20s that came to see me about a year ago because she had a really bad surgical scarring defect from a probably hemangioma excised when she was a preteen, and when they repaired it, it dehisced, and she was left with a horrible scar, thick scar here with deformity of the side. A very pretty girl, but the whole right lower side of her face was deformed. And I felt like I could really help her by injecting Bellafill in the area, but the scar was so thick, I didn't think I could get enough of a lift with that. So I said, what the heck? So we went ahead and did the Zimmer with her. Did about 5 or 6 treatments, a couple of weeks for a few weeks. And it softened up so much, I was able to go ahead and put the Bellafill in and put in a little makeup on. She looks almost normal now as far as the way it looks. It softened the scar that much. I was able to use Bellafill to get a lift. The next patient to talk about is a neighbor who was having problems post-repair of her knee, and she had contractures, scars. She'd had issues with the other knee before that was really hard to resolve. So I said, okay, well let's try this. So we had her coming in and again using the Zimmer to treat her post-surgical knee repair, and her therapist is amazed in measuring her, and just in a matter of about 6 weeks of treatment, she's almost resolved with almost complete mobility, and majority of her pain now is gone. And this lady said she's never seen anything work that fast and that well. And she's talking about sending me some of her problem patients. It worked beautifully with her. And the third patient we're talking about is, I do use a lot of Bellafill, and I have a patient that has developed a little bit of thickening of her Bellafill where I was treating with her acne scars, and started getting thick and fibrotic underneath there. It didn't look bad, but it was feeling a little too firm. And we've been using the Z-Wave on her, and we're softening the scars. The skin is getting a lot more supple and soft, and she's very pleased. And I have the last patient to talk about is a post-surgical patient, plastic surgeon who did blepharoplasty, and he got some really bad scarring out on both sides. And again, using the Zimmer on both sides of her hypertrophic scars, lateral to her eyes, a little bit of steroid injection, she's soft and just done beautifully with it. So think about it for fibrotic besides Peyronie's disease. Think about it for treating fibrotic lesions. It has worked really well in our hands.